It's World Suicide Prevention Day today, and we're putting a spotlight on Kenya, where, on average, 4 people take their lives every day. Now, as is the case in many countries, a large number of mental health problems remain undiagnosed and consequently unmanaged in Kenya. I'll be talking to my guest about efforts being undertaken by the government in this regard. But first, a suicide survivor in Kenya now, who has set up a studio and a safe space for young people going through mental illness.
Nearly 3 years ago, Jason Bruckner appeared to be leading the perfect life. But in reality, he was battling some inner demons.
I fell into pretty serious addiction, alcohol addiction, post-traumatic stress disorder. So the depression, the anxiety that followed from that was real. And I felt like, you know, my ideal life and the life that I was living were two completely different things. I knew who I wanted to be, I knew the life that I wanted to lead, but I felt that I had no way of getting there.
And a feeling that almost led him to do the unthinkable.
So I attempted to take my own life. You know, there was a feeling of hopelessness, of feeling alone. If I did reach out to anybody, that would be a burden. So I really saw no way out.
Luckily, Jason changed his mind in the end, but has made it his life mission to help others. He has created his very own organization in Kenya that not only supports artists and creatives battling mental health issues, but also provides a safe working space for them.
When you find your way out of a burning building, it's human nature to want to help other people out of that building as well. So that's why I set up Headspace 254 as a way to show other people that it's not hopeless.
The WHO estimates more than 800,000 people die from suicide every year. In Kenya, it's roughly 4 people taking their lives each day. Dr. Kirindi Odindo is a clinical psychologist and a psychotherapist, says there can be more factors behind suicide than traditional depression.
So there's issues of genetics. There's issues that are cultural factors. We've got other social factors. You've got other risk sort of situations, particularly now in the pandemic, because, you know, what the pandemic does is it's really been very detrimental to our mental health.
Still, mental health remains a sensitive issue in African society.
People don't come forward. The families will not come and tell you. It is taboo to talk about it. It is something that's held within our religious spaces, within our cultural spaces, and now also within the law and the policy.
It's a sentiment Jason shares as well, having lived in Kenya for 2 decades.
There's nothing to be ashamed of. There's nothing to feel guilty of. It's normal. And the more we put out, or the more we normalize the narrative of mental illness and talk more about mental health, the sooner that stigma will break down.
Something Jason and many others hope will help to save lives, not only in Kenya.
I'm now joined by Sylvia Kasanga. She is a senator in Kenya overseeing a proposed bill on mental health. Welcome to DW News Africa, Senator. Tell us about what you're doing to tackle the mental health challenge in Kenya.
Thank you so much, and thank you for having me. It's really an honor and a pleasure to be able to share with the world what Kenya is doing and what we are doing, championing the mental health campaign here in Kenya and mental health reforms. We are working on a bill as Parliament, which I sponsored, the Mental Health Amendment Bill, that is supposed to see an overhaul into the mental health space here in Kenya.
Right. What does the bill do in terms of actual action? What will it translate to if it is passed?
First is aligning all mental health interventions into the primary health care. That is the biggest intervention possible, because the old bill envisioned a standalone mechanism of tackling mental health, which really increases the stigma. So you'd find only a mental health institution standalones, where people now even have fear going to seek for medical help there. So what we want in the first instance is to integrate mental health in all levels of hospitals, all primary healthcare, so that we can have practitioners in, level 1, level 2, level 3, and have the referral system now actually working for mental health the way it works for primary healthcare. It also envisions a situation where access to healthcare for mental health is possible. So we integrate it into insurance systems so that you can actually get treatment. Treatment for mental health, especially the severe ones, is very expensive, and access to drugs is almost impossible for a lot of the Kenyans. So the bill envisions where it is part of all insurance schemes, especially the universal healthcare system that the government is currently rolling out. Yeah.
Senator, you've said before that mental health issues have never been given a priority in the country, and partly due to the lack of legislation. Do you think that things are going to change going forward now?
Yes, I'm happy that our advocacy work, our shouting about mental health has, it got to the ear of the president to the point where he gazetted a task force for mental health that went around the country now receiving, comments and details from Kenyans. And, unfortunately, because of COVID, we are seeing escalated cases going up. Now I've even made sure from where I sit that the Ministry of Health actually has, they have a committee that is dealing specifically looking into issues of mental health and how to help Kenyans, especially now with the COVID and all the other stresses that are related to COVID. Yes.
Senator, today the emphasis is on suicide, and as I understand it, attempting suicide is considered a crime in Kenya. You could be jailed for up to 2 years or fined. Do you think that law needs to be reviewed?
Absolutely. In fact, in the mental health amendment bill, we tried to do it, but we were told that is not the place to do it. And we're happy that the task force that was doing the mental health report actually gave a very strong recommendation that that section needs to be repealed and removed, because decriminalizing suicide is not tackling the problem. If anything, now you have even more cases because the fear of going to prison pushes the victims now to actually do it. So we've agreed as a society that is one of the key things that must be done in the short term, in the shortest time possible, is to repeal that section, remove it altogether, such that in such cases, what they do is seek help as opposed to being taken to jail.
Okay, that's Senator Sylvia Kasanga joining us from Nairobi. Thank you, Senator, and all the best to you on that bill.